Hello everyone and thank you for coming to my presentation. Through this presentation I plan to show you why Kettering should add a facility in Middletown, Ohio. Phase 1, our introduction and assessment. Through Kettering's mission to improve the quality of life of the people in the communities we serve through healthcare and education, we can improve the quality of life in the citizens of Middletown. Our vision is to create an integrated care facility that houses primary care doctors full-time with specialty care doctors time sharing the other offices. This way our patients only have to come to one place. It's like a one-stop shop. They can come in, get their family care, and if they need to see their specialist, do that, as well as have their blood drawn and x-rays. The facility will offer the patients of Middletown a second option that will hopefully become their first option. As of right now, the citizens of Middletown only have one option, a different healthcare organization to go to for their care. Our goal is to create a facility with integrated care that improves the access of care. We can educate potential patients of the resources available through Kettering Health Network, all while creating long-lasting relationships within Middletown with the patients, our citizens, businesses, and other providers. We can provide them quality patient and family-centered care. Why is access to health services so important? Well, gaining entry into a healthcare system like Kettering is important because there's continuity of care, there's longevity of services. You can always depend on being able to find a professional to treat you. It's important to give them access to a healthcare location where services are needed and provided all at one stop, so they're not driving 30 or 40 minutes to see a healthcare professional. Through our SWOT analysis, you can see our strengths. We are diverse, creative. We have experienced staff with a broad knowledge base. We have positive relationships in the industry and other state agencies. Our powerful data includes outpatient care utilization and physician office financial data. We have a strong internal agency IT infrastructure, increased revenue from the new facility, and we can improve the access of care, and we can develop our footprint in an underserved area. Some of our opportunities: community outreach, establish physician relationships. We can expand our focus to include services beyond primary care. We can expand our data collection to enhance the information and provide additional services and information to patients as time goes on. We can expand our services and footprint in a new demographic area. And we can provide care to this underserved community. In the beginning, the upfront cost is going to be steep, but through grants and a contract with the city, Kettering will not have to put all of that money out. We will find other fundraising and other funds to help with that. It's important to improve performance and accountability depending on having a shared goal that unites the interests of the activities and all the stakeholders. Our goal is what matters for patients and unites the interest of all actors in our system. If value improves, patients, payers, providers, and suppliers can all benefit while the economic sustainability of the healthcare system increases. For primary and preventative care, value should be measured for defined patient groups with similar needs, such as healthy children, healthy adults, patients with a single chronic disease, frail, elderly people. Those kind of populations will be monitored so that we can see the increase in our volume, the increase in our financials, and the increase in outcomes. The new services will create jobs as well as bring others into the Middletown city, other residents, other business people. Some additional resources: we will have to bring additional physicians and providers into the network. We will also need support staff, including RNs, MAs, the front desk. The facility itself, the new building or the new to Kettering building, will need to be fitted with all the computers and medical supplies and equipment, as well as Kettering's EMR system. Obviously, we have to give adequate training to the providers and the staff so that they are confident in providing that care, and as well to ensure that the Kettering mission and vision is followed and adhered to. The physicians in the beginning are also going to need to abstract their charts in and access to their current EMR records to ensure continuity of care. All the physicians will need to be credentialed with payers. The payers will also need to be given our new location and information, and vendor contracts will be negotiated to ensure that we are carrying over from the large Kettering network to this new facility. Our target area is Middletown and the surrounding areas. Our target population, because we want to provide family care, will be everybody, men, women, and children of all ages who seek primary care, as well as select specialty care. Again, create the integrated facility where it's a one-stop shop.